good old-fashioned surgery, if you will. So there's my friend the robot. He is, now, if you have to have surgery, this is the guy. This is the guy. Robotic surgery is the way to go. In this day and age, I'm going to go out on a limb and say probably more than 95% of surgeries, hysterectomies, should be robotic or minimally invasive. Now, minimally invasive just means small incisions. I like the robotic technology. There are some surgeons who prefer laparoscopy. I much prefer robotic. But in this day and age, if you hear people saying they're having a hysterectomy and they're not getting minimally invasive, and it's your family member, ask them why. There are, I said 95%, it's probably close to 98% of hysterectomies really can be done. Even those ones with those big old watermelons in there, we can do those. It takes some work on the part of the surgeon and the team, but it can be done. It just takes some time. Now, with that being said, there's some patients who, for different reasons, they might not be a candidate. But for the most part, it's not really based on the size of the uterus. Now, I kind of jumped to hysterectomy, but I skipped one step, myomectomy robotically. Myomectomy is when we actually cut out the fibroid. And you go, well, that sounds good, because now that's got to be better maybe than the other procedures where you're shrinking things. Now you're cutting out the fibroid. Why don't you do that more often? So out of all the ones that I mentioned, including hysterectomy, myomectomy is the hardest one. So, and it's the hardest one on the patient, believe it or not. Because what happens with myomectomy, so when we're doing a hysterectomy, our first goal, we start our surgery, our first goal is we know this uterus is being removed, so we interrupt the blood supply that's going to the uterus. That's like one of the first things we do in surgery. Because we interrupt the blood supply, it allows us to not have a lot of bleeding during a major surgery like a hysterectomy. We're doing it robotically, so we don't have going through all these layers. Now, we have to do a few things after that happens, but by cutting that blood supply off so quickly, it really minimizes blood loss for a patient. With a myomectomy, I got to keep your blood supply because I'm keeping your uterus. So what that means is when I'm carving out those big watermelons like softballs, we can get into a lot of extensive blood loss. So myomectomies, interestingly enough, in many cases are a much harder surgery than hysterectomies. Myomectomies are what we call the gold standard for somebody who wants to keep their uterus to have a baby. The other techniques that I mentioned, the data is accumulating that we think it's going to be okay. I just have to say, well, I don't really know. So we tell people if you are, say, 25 and you 100% want all options open to you for fertility, I have to do a myomectomy. Well, it can be a little tricky because if you got a big softball in there, you got a big, cannibal, that's going to be a tough surgery. Some myomectomies really probably have to be done open, strangely enough. So even most hysterectomies we can do robotically or minimally invasive. Myomectomies, most of them can still be done robotically or minimally invasive, but because of the nature of what's happening, more of those end up being open. It just depends on the surgeon's comfort level, the patient, and the size of the fibroid. So that's just a little bit about that. So when someone comes to see me, I say, okay, what are your goals? We already figured out that was a weird question, but then they get it. And then we talk about what's the little algorithm, what's the tree? Medication, the least invasive thing, nutrition basically. And then some patients, they'll start at nutrition, they'll say, let me just try to, get my diet, some antioxidants and see what I can do. And then they may end up at the, okay, doc, that's it. But some people will try and say, this is good enough for me. And I say, well, is your body tolerating it? Or, managing with some iron or whatever? This is good enough for me. So what is really important is that patients understand you don't have to be one size fits all. You have to be what is right for you. So there are times where I tell someone, I can talk about all the options that are out there, but it's not right for you. But then there are times where people come and they go, I want my uterus out. And I say, you have a fibroid this big. Why don't you try to do something? And then they go, oh, okay. So the point being, it's all over the board. And my whole goal was to be able to provide awareness, get people to ask and answer questions, so then you can take action. Because once you know, because first we don't even know, oh, I could have a fibroid. How are you going to ask a question about it? So now you can find out, you have to be aware, maybe I have a fibroid. Then you can ask and get questions answered. And then you can take action. Your action might be, I'm choosing to do nothing, or I'm choosing to work on nutrition, or I'm choosing to work on medication, or it could be I'm choosing to have a hysterectomy. But allow yourself and allow the people that you know to be able to take action once they know. We find fibroids all sorts of ways, pelvic exams, we feel them. Sometimes people are getting a CT scan to look at their gallbladder for something else, and they go, something looks weird down there, and then they come and see me. Sometimes it's the patient coming to me with her stomach sticking out, literally, and I'm saying, what is that? She had no clue. I felt so bad for her. She had no clue that she had fibroids. Her uterus, I took it out recently, it weighed more than 2 pounds. I said, how could you, nobody told you this? She said, I don't know. And she said, I just really thought I couldn't lose weight. She said, I've been doing all these sit-ups. I said, no sit-up is going to help that. So it's just really getting people, to understand what's going on. So awareness, answer and ask questions, and action. And don't forget about this.